कॉल आई थी कब तेरा मैसेज आया तो मुझे याद आया कि यार तो कॉल ही नहीं की मैंने
बिस्मिल्लाहिर्रहमानिर्रहीम अल्हम्दुलिल्लाह वस्सलातु वस्सलामु अला रसूलिल्लाह व अला आलिहि व सहबिहि व सल्लम अजमईन अल्लाहुम्मा अंफअनी बिमा अल्लमतनी व अल्लिमनी बिमा यंफअनी व ज़िदनी इल्मन इन्नकल अलीमुल हकीम अल्लाहुम्मा अखरिजना मिन ज़ुलुमातिल वहम व अकरिमना बिनूरिल फ़हम وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم أجمعين آمين يا الله اللهم بنعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل آمين يا رب العالمين. Okay, we start our case discussion today, and this is the first case. Any volunteer? Any volunteer? Today our cases, some cases they have spot diagnosis and some cases need differential diagnosis and some cases also need discussion. Describe the finding and what is the differential diagnosis, the procedure, and what is the probable diagnosis. And even in the case if it is a spot diagnosis, we try to describe it. Okay. Okay, the first case. Any volunteer for the first case? Any volunteer for the first case?
أنا بحكي حكيم عادي.
تفضل.
This is an axial T1 Mri showing a few hyperintensities seen, or a few relatively well-defined hyperintensities seen at the parasagittal location at the right centrum semi-oval. A single flick is seen at the interhemispheric fissure. I think this is a lesion. This is a lesion which is heterogeneous, containing fat density component and the hypointense components.
Okay, what is your differential?
What comes to mind, I think maybe ruptured dermoid, maybe. I'm not sure, صراحة, or dermoid.
Okay, other differential. Okay, what are the differential diagnoses in T1 if you see hyperintensity other than fat?
Hemorrhagic signal.
Okay, hemorrhage could be hemorrhage. This is one. Second, fat.
Could be melanin.
Could be melanin and could be calcification. مظبوط ولا لا?
Yes.
Okay, you see here. You see here. دقيقة شوي. Here in the interhemispheric fissure there is calcification. مظبوط ولا لا?
Yes, yes.
And that calcification, it is hypersignal intense. This lesion doesn't fit with dermoid rupture. مظبوط ولا لا 100% مظبوط?
Yes, yes.
And doesn't fit with fat. And you have some خلينا نحكي hemosiderin on the periphery here, on the periphery of that hyperintensity, okay, and hypointensity areas in other than the lesion, okay. What do you think now? What do you think now?
فالكس لايبوما
No,
ميتافازي
Cavernoma.
cavernoma, very good.
Cavernoma.
Cavernoma or cavernous hemangioma. It is very good. So this lesion, and you said this is you said it is in non-contrast or contrast this study.
Non contrast.
Huh? Contrast or non-contrast study?
Native study. Native study.
Okay, we don't see contrast. Okay, so this is cavernous hemangioma or cavernoma, whatever you like to call it, and what we call this sign.
Popcorn.
It is popcorn
Popcorn.
sign or mulberry sign. Okay. Anyone remember the popcorn calcification where we see it in the chest?
ان
Hamartoma.
هامرتوماس
Hamartoma.
Hamartoma. Okay, we see it in hamartoma. So this is a classic popcorn sign with cavernous hemangioma, can be seen in the brain, can be seen in the spinal cord, and with no mass effect. Okay, and you see here there is a previous surgery in that area. Okay. Okay, any question on this?
اوكي
So this is in summary, heterogeneous intensities, hypersignal, hyperintense, hypointense with hemosiderin consistent with cavernous hemangioma. And this is popcorn sign. Other name, it is mulberry sign. Okay, thank you. Next case. Any question on this?
It's okay, thank you, Hakim.
Okay, next case. Okay. Anyone put spot diagnosis for this case? Anyone put the spot diagnosis for this case? Or name the sign. What is the sign name here?
String of beads. String of beads.
ايش هو؟
String of beads.
No.
MS black hole sign.
Black hole.
Black hole sign, MS. Okay, describe the lesions here. Okay. This is a black hole sign, T1 image. What signifies a black hole sign?
Inactive MS.
Inactive MS. Okay, means it is a chronic stage and there is axonal destruction and irreversible damage to the axons of the white matter. Okay. So this is a black hole sign, and this is the classic for MS, multiple sclerosis. Okay. And this sign,
Dawson fingers.
Dawson finger.
Dawson finger. What is Dawson finger?
Hyperintensity is seen perpendicular to the corpus callosum, giving the appearance of fingers, maybe.
Okay. يعني زي إذا حدا بتذكر أصابع زينب، زي أصابع زينب عندنا حلويات، ها؟ بس دوسن اسم واحد يعني صراحة، Scotch pathologist. Okay, this is the Dawson. Why it is perpendicular to the ventricle, body of the ventricle? Anybody? Why it is perpendicular? Okay, why? Because
Direction of white matter tract.
no, because here there is medullary veins, and it is يعني موازية these medullary veins are perpendicular to the body of the lateral ventricles, and it is along the medullary veins, long axis of the medullary veins, this dorsal finger. This is distributed along the axis of the medullary vein, and these medullary veins are perpendicular to the body of the lateral ventricles. And seeing this, it is seen in what? In multiple sclerosis. مظبوط. اوكي، في شيء ثاني بالصورة هاي؟ في شيء ثاني؟
في كأنه فرونتال انسيفالوسيل.
اوكي، في frontal sinus pathology. اوكي، في hyper intensity in the frontal sinus, could be sinusitis or other pathology. We don't know the we don't have any other images, and also the maxillary sinus also it is involved. Okay. Okay, any question on this dorsum finger? Okay, we move to the next case. This next case, anyone?
Axial MRI.
Okay.
MRI T1 post-contrast axial section.
Okay.
Showing 3 lesions occupying the left frontal lobe.
Okay, very good.
With the incomplete ring enhancement.
With incomplete ring enhancement. What that signifies?
Tumor factive MS.
Can one of the differential diagnoses is it is MS, multiple sclerosis, okay, and other differential diagnosis?
Abscess, multiple abscesses.
Abscess, it is complete ring, okay?
Complete ring, yes.
Okay, complete ring. Here, the diagnosis, it is demyelinating disease. It is include multiple sclerosis and Adam.
Adam.
Okay? Acute disseminated encephalomyelitis, okay? This is the multiple sclerosis can enhance, it is enhancement, it is different from case to case. Can have ring enhancement, can have solid enhancement as here, and can have incomplete ring enhancement. And what is indicate that enhancement of multiple sclerosis?
Activity, disease activity.
It is indicating activity in the disease. And usually we see the incomplete ring enhancement or solid enhancement in tumor active lesion of the multiple sclerosis. Okay.
Okay.
Any question on this? So next case.
Double PCL sign.
Double PCL sign. What does that mean?
Bucket handle tear.
Bucket handle tear. Which meniscus?
Medial meniscus. Posterior horn of medial meniscus.
Posterior horn medial meniscus. في شيء ثاني بالصورة؟
Joint effusion.
Joint effusion. Where is the joint effusion? Huh? This is T1 أول شيء. مبين joint effusion 100%.
Patella is high.
There is severe atrophy. There is severe atrophy of patellar tendon with moderate atrophy of quadriceps tendon.
Okay, very good. في شيء ثاني؟
Patella is high in location. Patella alta.
It is okay. Okay, ماشي. في شيء ثاني بالبون مارو؟
Red bone marrow reconversion.
Red bone marrow reconversion. Okay, very good. And what is this ligament here? This is normal or abnormal?
Yes.
Normal.
What is the name?
This is meniscofemoral ligament.
Meniscofemoral ligament. What is the name?
Rosberg.
Rosberg.
Rosberg ligament.
Okay, Rosberg ligament. Humphrey anterior, Rosberg posterior. Okay.
Bird posterior.
Yes.
Okay. Any question on double BCL sign, bucket handle tear of medial meniscus? Any question on this? Okay.
Relation with Axial T1.
الله يلعنكم نقول هذا الله يلعنكم نقول بالعدل خلفتي يلعن الخيبة عندي كان زمان قتيل زمان صحتي
مش شرط تكون معها ACL tear, okay? مو شرط. It is not necessarily associated with ACL tear, okay? Any question? Our next case, patient with abdominal pain.
Nemo medicina. Nemo peritoneum, sorry.
Now we describe this case, huh? We want description, the finding and diagnosis.
Selected axial image from contrast enhanced of the abdomen, portal venous space shows free air in the anterior to the liver and stomach.
Yeah.
Features free air. Pneumoperitoneum.
Pneumoperitoneum. في شيء تاني? Any other things?
Yes, there is an free air in the posterior wall of the stomach also noted.
Okay, you mean this one? You mean this one?
Yes, this one.
Okay, so this is abnormal air here in the posterior wall of the stomach at the lesser curvature between the stomach and the liver. And this, what does that mean? What does indicate?
Perforated peptic ulcer disease.
Probably perforated peptic ulcer disease, and this is, it is confirmed by surgery. It is perforated peptic ulcer. Okay, gastric ulcer. Okay, any question on this? Today are simple cases, not okay. في شيء تاني بالصورة هون؟ Any other abnormalities? Any other abnormalities in this picture?
Pancreatic atrophy?
No, it is above the pancreas. Okay. Any other vertebra في شيء؟
Oh, change.
Hemangioma.
Hemangioma. There is a small hemangioma. What we call this sign?
Polka dot sign.
Polka dot sign.
Polka dot.
Polka dot sign. Very good. Okay. We move to the second case. Next case. Okay. Next case.
Femoral head fracture. Radial head fracture.
Radial head fracture. My incomplete answer. So
Right, undisplaced.
Right, non-displaced radial head fracture. Okay, you should put right. Okay.
Yes.
بالامتحان you should put right, and this is non-displaced radial head fracture. Okay, this is simple case, very simple. This case,
acrosteolysis.
Acrosteolysis. Okay, describe the finding.
Can I speak, doctor?
Yeah, you can.
IP view of the both hands is showing subperiosteal erosion.
Are you sure there is subperiosteal erosion? Hmm? Subperiosteal or tuft erosion? Hmm?
I see some periosteal, some of periosteal reaction involving mainly the.
Wait. There is no periosteal reaction. Where will you see periosteal reaction? Where?
The middle finger of the right hand.
Middle finger of the right hand. This is the middle finger here. Where? In the which phalanx? Which?
Distal, proximal part.
Proximal here. Huh?
I have no pointer.
Hi. In this area?
Yes, above.
No, there is nothing here. Look at the distal tufts. The tufts of the finger. You see
terminal tuft. Terminal tuft. Yes.
Terminal tufts are ايش؟ شو مالها؟ Multiple terminal tufts are resolved. مظبوط ولا لا؟
Resolved.
Yes.
And also the distal, also there is resorption of the sum of the distal phalanges. Here you see here.
Yes. Hyperparathyroidism.
Okay, and here the tufts and distal phalanges are resolved. Okay.
Yes.
What are the differential? أنت حكيتي the main cause اللي هو acro-osteolysis. What are the differential?
Hyperparathyroidism.
Hyperparathyroidism, one of the causes, yes.
Scleroderma, frostbite.
Scleroderma, okay.
Psoriasis.
ايش هو؟ Psoriasis, very good. Okay, بعد.
Trauma.
بعد.
Diabetes ممكن يعمل.
Diabetes ممكن يعمل, okay. Collagen vascular disease, okay.
Leprosy.
Leprosy, okay, very good. These are some of the causes, and here you have the differential list of the causes, and you have pneumonics, B for psoriasis, pycnodystrosis, injury, thermal injury, frostbite or cold injury, neuropathy, diabetes, leprosy, collagen vascular disease, scleroderma, Raynaud, hyperparathyroidism, familial, there is one syndrome here, and this is also exposure, polyvinyl exposure progeria, okay? These are some of the causes of the acro-osteolysis, and this patient has, for example, لو حكينا, what question you want to ask to reach the diagnosis?
The laboratory investigation is important, and the previous past history of the patient.
If there is any
dysphagia.
Okay, we want to ask dysphagia, if the patient has dysphagia. أي واحد فاتح الفيديو تاعه ورجاني سكره. وليد محمد سكر الفيديو الله يخليك تاعك. وليد محمد سكر الفيديو. Okay, so this dysphagia, if the patient has dysphagia, what is the diagnosis?
Scleroderma.
And this is a case of scleroderma, okay? Okay. Any question on this case? Acro-osteolysis, and it is differential diagnosis, okay? Okay, next case. We have cardiac case. Okay.
Origin of the right coronary artery.
Yes.
Is abnormal.
Origin of the right coronary artery is abnormal. From where it is origin?
From the left coronary sinus.
From the left coronary sinus. Okay. From the left coronary cusp. Okay. Left. Yeah, left here and the right in the same origin. Okay. And this is the left cusp. Okay. Okay. What we call this origin?
Malignant origin.
Malignant origin. Okay. What is the anatomical structure of this one?
This is the aorta.
Standing aorta.
This is the aorta, root of the aorta, and this one?
Pulmonary artery.
Pulmonary trunk. Okay. And here you see this is the right pulmonary, sorry, the right coronary artery. It is between the aorta here and the pulmonary trunk here, and this is the left one. Okay, the left coronary artery here, and this is the malignant type. What is the treatment of this case?
Surgical reimplantation of the right coronary artery.
Surgical reimplantation of the right coronary artery. Very good. Any question on this malignant type of malignant origin of the or malignant cause of the right coronary artery? There's some atherosclerotic changes, soft plaques on the left side. Okay. Okay. Next case. What is the name? What is the name of the sign here?
Parfait sign.
Parfait sign. Parfait sign. What is parfait sign?
Parfait sign indicating fluid fat level, or
fluid fat fluid level. Okay. What is the how many levels in the parfait sign seen?
3 levels. 3 levels.
3 levels. Okay. The upper one is
fat.
The upper one is fat. The middle one
fat.
The middle
synovial or serum. Synovial fluid or
okay. And the third one, the bottom one,
hematocrit.
RBCs. Okay. Because RBCs in the dependent part. Okay. So this is indicate what?
Intra-articular lipohemoerythrosis consisting with intra-articular. in our case knee fracture, intra-articular knee fracture here.
We should, if we don't see a fracture, if you don't see a fracture in the other images, it is indicate occult fracture, intra-articular knee fracture. Okay, it is indicate intra-articular knee fracture, and this is what we call this lipohemoarthrosis. Okay, 3 layers. Okay, lipohemoarthrosis. Okay, any question on this case? This is Parfait sign, and with 3 layers. The first one, the uppermost one, it is the fat. Second one, synovial fluid and or serum, and the third one, RBCs. Okay. Next case. Okay. Next case. Simple case. Anyone?
Left-sided pneumothorax.
Left-sided pneumothorax. في شيء تاني؟
With wide
Obliteration
visceral
of the left costophrenic angle consisted with effusion.
في pneumothorax. اوكي في شيء ثالث؟
Faint curvilinear calcification surrounding the lung superiorly.
When?
Superiorly.
This is the white visceral.
Yeah, what we call it white visceral sign. في شيء ثالث؟
في rib fracture left.
في rib fracture here. Okay. So in this case, we have pneumothorax, hydropneumothorax with effusion or hemoarthrosis because it is a rib fracture, and this is a rib fracture causing the pneumothorax. Okay. Any question on this?
Okay.
Okay. This case?
Victus excavatum.
Victus excavatum. What are the signs here? What are the signs?
Loss of right heart.
Excavatum.
The posterior ribs become more horizontal and the anterior ribs become more vertical. Give the sign.
This is the posterior horizontal and this is the anterior vertical. Okay. Okay. في شيء ثاني؟
Apparent opacity on the right middle zone.
Opacity on the right middle zone, simulating middle lobe collapse.
Simulating right middle lobe pneumonia.
أو pneumonia. Okay. لو كانت هاي female, what
shift of the
in female
additional sign on this?
Medial border sign.
Medial border breast sign. Okay. Medial border breast sign. What is the name of the severity index? Haller index. Okay. The normal value what is the normal value?
3.25.
3.25. Okay. Any question on this Victus excavatum? Okay. Next case. Next case.
Multiple non-enhancing small lesions seen, non-enhancing hypodense lesions.
The procedure. What is the procedure?
CT scan. Arterial and portal venous.
Selected images of CT scan after contrast enhancement. Okay.
Yes.
Both after contrast ولا one after contrast والثاني not after contrast?
Both with contrast.
Both with contrast. Okay. What you see?
Multiple hypodense non-enhancing lesions throughout the spleen.
Throughout the spleen. Okay. في شيء ثاني معها؟ Negative findings here, it is important, okay? Negative findings. What are the negative findings you look for?
The liver is normal.
Liver is normal. Second,
no lymphadenopathy.
No lymphadenopathy and no fluid collection. These are the negative findings and are important. Okay? Okay, what are the differential? What are the differential?
One of the differential lymphoma. Second sarcoidosis.
أول واحد إيش هو؟
lymphoma.
Lymphoma.
neuropathy and other supportive features.
Okay.
ثاني شيء sarcoidosis.
Sarcoidosis.
Microabscess.
Microabscess. Okay. بعد.
Candidiasis.
Candidiasis. Okay. بعد. Metastasis. Okay. Or small hemangiomas. Okay. What next you want to reach the diagnosis? Is there any specific question you want to ask?
History about immune status.
Then history about immune status of the patient. If the patient has immune compromised, it is more with candidiasis or infection. If the patient doesn't have his normal immune status, the patient has normal immune status.
Chest X-ray.
Chest
Primary.
Okay. Chest X-ray. We want to see the chest X-ray of the patient. Has lymph node. Okay. If he has lymph node. Okay. And this is case of actually sarcoidosis of this patient. Okay. Okay. Thank you. This is very good. Okay. Next, any question on this case? Okay. Let us move to the next case. Okay. This is young patient, 28 years old. Okay. What is the procedure? What is the finding? Describe the finding and differential diagnosis and most likely the diagnosis. What is the most likely diagnosis and what is the recommendation also? We need the recommendation. Okay. What is the mean? Any volunteer for this case? Any volunteer for this case? Any volunteer? علاء بدك تتبرع؟ علاء. Any volunteer? Any volunteer for this case? مالكو ما بتخوف الكيس. Very simple case. ها؟ Any volunteer? What is the procedure here?
Barium.
Okay, barium meal. Okay, barium meal. What do you see in this barium meal? Okay, وليد تفضل. وليد محمد, if you want to talk. وليد. وليد محمد, if you want to talk. وليد انت رافع ايدك, if you want to talk. Any other one? Any volunteer?
Okay, sir. Can I talk?
You can talk.
Okay, these are selective spot view of barium swallow double contrast.
Barium meal, okay, huh? Barium meal.
Sorry, barium meal double contrast. There is fixed narrowing of the gastric body and antrum.
There is narrowing of the gastric body and antrum. It is not distensible, okay?
Okay. With abnormal nodular mucosa.
With abnormal nodular mucosa. In which film, on the left side or right side?
On the left side.
On the left side. في شيء تاني معها؟
Focal collection of barium pool.
Okay, focal collection in that area. Okay.
Yes. Suggest focal ulcer. Yeah.
Suggest ulcer. Okay. Very good. Okay. What is your differential?
Primary adenocarcinoma of the stomach.
Okay, it's adenocarcinoma of the stomach. Okay, yes. Other differential?
Lymphoma metastasis.
Lymphoma metastasis. Okay. Other differential في شيء ثاني معاها؟
gastritis.
ها؟
gastritis.
ايش هو؟
gastritis.
gastritis. طب gastritis بتعطيكي loss of distensibility of the antrum and the body. Okay.
In ugly ulcer.
Menterier disease.
Okay. We want to rule out infection. Okay. Also, we want to rule out caustic ingestion. Okay. Okay.
Corrosive and Crohn's disease.
Yeah. Crohn's can give this appearance. Yeah, Crohn's can give this appearance. The loss of distensibility of the antrum and the body, what we call it?
Rhinitis plastica.
Rhinitis plastica. Okay, very good. So these are the differential diagnoses of this patient. And I told the patient is 28 years age. What the next step we want to do for this patient?
Biopsy and CT for staging.
Biopsy and CT for staging. Okay. Okay, this is the CT scan for this patient.
Lymphoma. Lymphoma.
What you see in this patient?
Apart from decreased distensibility of the stomach, there is effacement of the gastric mucosal fold and the circumferential nearly symmetrical thickening, homogeneous enhancing the wall of the stomach. With multiple non-hypodense lesions scattered through the liver.
Bus liver?
And both kidneys.
And the kidney. في شيء تاني؟ في lymph node ولا لا؟ ما انت كنت بدك تقول.
Yes, in the gastric hepatic region, gastrohepatic region. There is
okay, في lymph node here, في lymph node here, okay.
And the porta hepatis.
And lymph node here, and lymph node here, okay. Multiple lymph node involving with this. What is the most likely diagnosis?
Lymphoma.
Why lymphoma?
يعني symmetrical homogeneous enhancement of the stomach يعني with the multiple lymph node.
Okay, it is not symmetrical here.
Okay.
Okay, it is not symmetrical. If it is lymphoma, why you have both lymph node in the porta hepatis, lymph node here around the greater curvature, lymph node in the gastrohepatic ligament region and lymph node here in the level of the adrenal gland. So this is the distribution of lymph nodes doesn't suggest of lymphoma, okay? It is suggest of adenocarcinoma, okay? And we said from the beginning, it is loss of distensibility of the stomach. Lymphoma will not cause loss of distensibility of the stomach. مظبوط ولا لا?
Yes.
If it is caused, like it will cause, looks like aneurysmal dilatation.
Maldilatation.
Yeah, okay. So this is against lymphoma. So this is most likely, given with this picture, it is most likely adenocarcinoma, and it is proved by biopsy. Okay. Okay. في شيء بالكدني؟
Multiple hypodense enhanced lesion.
Multiple hypodense lesion. What is that?
Polycystic.
Okay, probably.
I should measure the house field, maybe يعني metastasis or يعني simple cyst bilateral.
Yeah, with multiplicity, with liver lesions, probably a polycystic disease and the age of the patient, okay? Any question on this? How many types of gastric carcinoma you know? Morphologically. Okay, you have the ulcerative type, you have the tubular type, and check the other types, huh? We have the mucinous, papillary, okay. Okay. Any question on this nice case, adenocarcinoma, for this unfortunate patient? Okay.
Sir, if with these features, there is lymph node below the renal vein, still we put adenocarcinoma before lymphoma? Because lymph node metastasis does not extend below renal vein. It is one important.
الصوت تاعك بيقطع مش فاهم شو بتحكي صراحة.
One of the differentiating point between gastric adenocarcinoma and lymphoma surrounding fast stranding, which is minimal in lymphoma, and second, any lymph node below renal vein goes with lymphoma rather than adenocarcinoma.
أول نقطة إيش هي؟
Surrounding inflammatory, surrounding fast stranding.
Okay.
Less fast stranding in lymphoma than adenocarcinoma. Okay. Second, any lymph node below renal vein goes with lymphoma rather than adenocarcinoma.
Yeah, في عندك هنا في any stranding around the lymph nodes. شو رأيك؟ في stranding?
Yes.
Yeah, you have stranding here at the renal ligament in that area. You have stranding, and it means that it is infiltration. And yes. Here also here between the stomach and the pancreas, okay, in that area, and in that area, and in that area, all كلها are stranded. Oh, مظبوط?
Yes.
And lymph node below the posterior to the splenic vein, and even you have also the left adrenal gland. It is nodular compared to the right side. Okay.
Yes.
Okay. Any question of this? Next case. Spot diagnosis. We need spot diagnosis for this case.
Left proximal pharyngeal avulsion fracture of the thumb.
Indicate what? Avulsion of, okay, which ligament
Left.
here is involved?
Ulnar collateral
Under-
ligament.
Yes.
Under collateral ligament of the thumb, it is involved, giving the appearance of
Gamekeeper thumb.
gamekeeper. Okay. This is avulsion fracture of the ulnar collateral ligament of gamekeeper. Okay. This is spot diagnosis. Okay. Next case.
Left-sided Hutch diverticulum with ipsilateral VUR or
حاول ما
psychoelectric junction reflex.
حاول ما تحكي اختصارات بالامتحان. اوكي.
Yes,
حاول
that's
ما
right.
تحكي اختصارات.
Okay.
لأنه مش كل الناس حافظة اختصارات. اوكي.
صحيح.
كل الناس حافظة اختصارات. This is Hutch diverticulum with reflux on the left side. Okay. And this is the corresponding CT scan of this patient. Okay. Any question on this? This is congenital diverticulum or it is acquired diverticulum?
Congenital one.
Yeah, this is congenital diverticulum. Okay. This is congenital diverticulum. Okay. This case.
Jones fracture.
ايش هو؟
Right fifth metatarsal Jones fracture.
Right fifth metatarsal transverse fracture. What we call this fracture?
Jones fracture, as our partner said.
Yeah, Jones fracture. Treatment?
I think it's
internal
fixation.
Internal fixation. Okay, very good. What are the other types of fracture of the base of the fifth metatarsal bone?
Avulsion fracture, dancer fracture.
We have avulsion fracture. And the third one, what is that?
Stress fracture.
Stress fracture.
Okay. Treatment is avulsion fracture treatment is
also needs
no, it is conservative treatment. Okay, and this here need internal fixation, and the other fracture it is also need internal fixation because it is in the shaft. Okay.
Okay.
Check المعلومة. Check the okay.
Okay, I will check. Okay, thank you, doctor.
Right shoulder X-ray.
Light bulbs.
Posterior dislocation.
Light
bulb sign indicating posterior shoulder dislocation.
Indicating posterior shoulder dislocation. Okay, في شيء ثاني؟
Maybe there is post surgical.
Actually, there's surgical sutures here in that area. في شيء ثالث؟
ACA oil changes. Arthritis.
Narrowing of acromioclavicular joint. With subchondral sclerosis suggests OA changes.
Okay. And this is the light bulb sign indicating posterior dislocation of the shoulder. How account posterior dislocation of the shoulder? Come.
5%.
Yeah,
5%.
5%. Okay. 5%. Okay.
2 to 5. Yes.
Okay, this one.
Jack Stone urine bladder calculus.
Jack stone, bladder calculus. What is the type of stone here?
Mostly calcium oxalate.
Calcium oxalate, okay.
Or any calcium containing.
Huh?
No,
Yeah.
no, it's يعني almost إنها oxalate يعني calcium oxalate mixed يعني content.
Okay. Any question? This one?
Lateral cervical spine X-ray show flowing ossification along the anterior vertebral bodies with normal intervening disc spaces and normal prevertebral tissue.
Okay, very good. What does that indicate?
Dish.
Dish. شو الاختصار لإيش dish?
Diffuse idiopathic skeletal hyperostosis.
diffuse idiopathic skeletal hyperostosis. الاسم الثاني تاع حفظتيه؟
Forster disease, I don't remember really.
Yeah, Forster disease. Okay. في شيء ثاني بالصورة غير هاي؟ غير
fracture of the spinous process. 1, 2, 3.
Clay-Shovler fracture.
Spinous process of C6.
أي واحدة؟ Fracture? Are you sure it is a fracture?
Well corticated. Calcification of nuchal.
Accessory point the nuchal ligament.
Of nuchal.
إذا calcification of nuchal ligament. Okay. What is the differential diagnosis other than this?
Ankylosing spondylitis, but the ossification is not fluffy like dish.
Okay.
More fine.
Then the bridging, it is, we call it, what we call that bridging? Ossification.
Syndesmophyte.
Bridging syndesmophyte, here flowing.
Okay.
And dish.
Okay. And here, SI joint, it is involved in dish?
No involvement.
Spared.
It is
even the facet joint, not involved in dish.
Not involved. Okay. Okay. Other differential? Juvenile rheumatoid arthritis. Okay, very good. And other differential?
Seronegative spondylar arthritis.
Okay, ما هي مع ankylosing spondylitis and the fluorosis, okay? And this is, oh, sorry, okay, this is the second case, the last case, our last case here.
Ossification of posterior longitudinal ligament.
Ossification of posterior longitudinal ligament here, as we see here. Okay, and we see here, okay? So, ossification, شو بتعرفي عن ossification of posterior longitudinal ligament?
شنو؟
It can be isolated abnormality or maybe associated with the dish also.
Can be associated with dish, okay, very good. Can be associated with dish, okay, بعد.
May compress the cord.
ايش هو؟
Hydroxyapatite deposition disease, HAD.
Okay, but can associated with other than dish? Can associated with ankylosing spondylitis also? Yes, okay.
Can be.
And can be associated, and this it is common in the Asian people, okay? In this, this disease, okay? And it is involved usually the cervical region, okay? And it is in about 75%, okay? and can be followed with trauma, okay? Can follow the trauma. And there is, in the box, there is a staging. We try to read the staging and how cause the compromised spinal canal and spinal canal stenosis, okay? We try to read that, okay? Any question on the ossification of posterior longitudinal ligament? Okay, this is the last case with the spine. Okay, what is the procedure here? Anyone? بجوز ما شفتوها هاي صراحة.
Discography?
Discography, very good. This is discography, very good. What you see, which disc is normal, which disc is abnormal here. We have 3 discs here. In this procedure, we have this one, L2, L3, L3, L4, L4, L5, and
L4, L5,
L4, L5.
L4, L5.
This is L3, L4, L5, L2, L3. These are abnormal, okay? These are abnormal. Why? Because the contrast, it is seen outside the outside the annulus, and here the contrast is leaking outside in the with the annular tail, okay? And here the contrast, it is seen in the nucleus bulbosus. If you see the contrast in the annulus bulbosus and leakage, it is indicating annular tail. في شيء تاني بالصورة هاي. This is normal here. This is normal L2, L3. Here
fracture parts of L5.
ايش هو؟ ايش؟
Pars fracture of L5. Pars defect of L5.
Yeah, pars articular defect. Okay, in this area at the level of L5 is one.
L5.
Okay. So this is normal discogram. This is abnormal, and they said the discogram. It is very good for localizing the patient pain. If the pain, sometimes about 20% of patients, if we do the CT scan or MRI for the lumbar region, they have disc, but we don't know which one cause of pain. So the discogram is the best procedure to indicate that the disc, it is causing pain. Okay?
Okay.
طبعا هسه it is not used, by the way. This is not used in this era. Okay? It is invisible procedure. Any question on this discogram or discography? اوكي ان شاء الله نشوفكم الاسبوع الجاي
ان شاء الله.
ان شاء الله.
ان شاء الله. بارك الله فيك، يعطيك العافيه حكيم.
ان شاء الله.